Hello viewers, welcome to another video from MedCity International Academy, and in this video we are about to discuss how to start a conversation effectively in OET speaking subtest. According to the patient, according to the age of the patient, the way we talk would completely differ. If it's a patient of your age or a middle-aged man, you can have a conversation accordingly in a general way. If it's a known patient, you don't have to introduce yourself. Rather, you can establish the conversation as you know or you both are familiar with each other. How do we do that? Take an example. Our patient's name is Sam, and Sam has been admitted in the hospital since last Sunday. So the conversation happens after his operation. You don't have to introduce yourself to a known patient because the person knows you, right? You can have a conversation like this. Good morning, Sam. How are you feeling today? Or you can ask, good morning, Sam. Did you get a sound sleep last night? It's perfectly all right. What does that mean? You both know each other, so you don't have to introduce yourself. If it's an unknown patient, the way we talk would be completely different. You would have to introduce yourself. Good morning. My name is Jitesh and I'm a nurse in this ward. What brings you here today? Or how can I help you today? So that's how it is. What if it's a child, if it's a kid that you're about to talk to? Then the way you talk would be completely different. There would be ups and downs in your talk. There would be the right kind of intonation that you would use to communicate with the child. Let's take an example. Our child's name is Mike. How would you say? Would you say, good morning, Mike? No, that doesn't sound, or that doesn't suit, or that is not appropriate to that situation. You would have to be a little more pleasant and a little more happy when you talk to a child, right? Good morning, Mike. How are you today? That's perfectly all right. The way you talk would completely change according to who you are going to talk. And the rule applies when if it's a bystander or a relative of a patient, or if it's an elderly person. If it's an elderly person, it's important that your voice carries a little bit of respect. Good morning. I'm a nurse in this ward. How can I help you today? That's fine. And if it's a bystander or a relative of a patient, that differs again. You can introduce yourself. My name is Jitesh and I'm a nurse in this ward. How can I help you today? That's perfectly all right. And they would tell you, all right, I'm on behalf of a patient called David, and this is how blah, blah, blah. Things would go on, all right? So that's how we start a conversation according to the age of the patient, all right? Now let's look at setting. How does a setting affect the way we start a conversation? If you look at the setting and the setting says, it's an emergency ward. If the setting says it's an emergency ward, how would you start the conversation? You don't have a lot of time to start the conversation. It's an emergency ward, right? It has to be quick, right? How would you do it? Hi, my name is Jitesh. I'm a nurse in this ward. What brings you here today? And go on. It's fine. It's quick. But if it's not an emergency ward, if it's a hospital ward, you have all the time. You can say, good morning. How are you feeling today? My name is Jitesh. I'm one of the nurses in this ward, and I am assigned to take care of you today. That's perfectly all right. So that's about emergency ward and a hospital ward. What if the setting is a home visit? You're about to visit somebody's house. So the way you start the conversation would be a bit different. You don't have to introduce yourself. Before that, you can say, good morning. Is this Mark's house? And the patient says, yeah, this is Mark's house. Can I talk to Mark? And the person says, yeah, I am Mark. You can talk to me. Now you can introduce yourself. You can say, hi, Mark. My name is Jitesh. I'm a nurse. I'm a nurse who works in the district hospital, and I'm here to teach you how to do the self-administration of insulin. And that's it. And what if the setting is something else? How do we do that? Think your setting says it's a community health center. So if it's a community health center, a patient would come to have a talk with you, right? So if it's a community health center and you would start a conversation as, good morning, please take your seat. And the patient takes the seat in the role play, and then you can ask, how may I address you today, or what brings you here today, the way you like, and you can carry on with the conversation. Now that's how we deal with community health center. But what if it is an outpatient OP? What does that mean? The patient is unknown. The patient is not a known patient. The patient is unknown. In that case, you have to clearly introduce yourself. So how do we start the conversation? My name is Jitesh. I'm a nurse who works in this ward, and what brings you here today? And the patient would tell you the complete story, what brings that patient there in front of you. Now once you hear the story, you can say, acknowledge the fact that the patient told you the entire story, and say, thank you for the information, how may I address you today? And the conversation goes on. All right, so we have so far discussed about emergency ward, we've spoken about a home visit, we have also discussed about outpatient, right? Now there is something important that we need to discuss. What if the situation mentioned in your card says it's a post-operative ward? The patient has been admitted in the hospital since last Sunday, and the patient is right there after the operation. How would you start the conversation? The moment you read it, you can understand the patient has been admitted in the hospital for a while now, and he's recovering after an operation. What does that mean? The patient is a known patient. Like we said at the beginning, we can establish the fact that the patient and the nurse are familiar to each other. So you can, before the conversation starts, you can ask the interlocutor, how may I address you? And the interlocutor would tell you the name of the patient. All right, let's take an example. The interlocutor told you the name of the patient is Jack. All right, Jack. So how would you start the conversation? You can start the conversation naturally. Good morning, Jack. I hope you got a sound sleep last night. And Jack would carry on the conversation, and you can continue with it. Now that's important, right? Let's take another example, another situation here. The situation is emergency ward. Think about the same scenario. You're in an emergency ward and a patient comes to you. How can you start the conversation? Can you start the conversation the way I started before in a post-operative ward? No, in a post-operative ward, you and the patient are familiar to each other. Familiar people, right? So in this condition, the patient is a completely unknown patient, completely unknown person, and you have to introduce yourself. But just before that, you have to understand this is an emergency ward and it has to be quick, right? So I can start a conversation like this. I'm called Jitesh, I'm a nurse in this ward. How can I help you today? Things become quick, right? So that's important when it's about an emergency ward. But what if it's a general ward? If it's a general ward, you don't have to hurry. You can take your own time. You can say, good morning. I am a nurse who works in this hospital. Please take your seat, and how can I help you today? You have a little more time, you're relaxed, and you're not in an emergency ward to make it quick. So you have enough more time to have a conversation. So these are important things that we need to really keep in mind when we're about to have a conversation in OET speaking. According to the situation, the way we talk differs. According to the setting, it changes. And according to the age of the patient, the way we talk, the intonation has to be different. And you keep all these things in mind, and you practice having conversation on different settings, different role play cards for a certain amount of time. Your English is going to be really good. I hope this video is helpful to you, and we will see you in another video. I wish you all safe and a wonderful time at home. Take care.